Ringing in the ears can cause a lot of anxiety and frustration for the person experiencing it. Board-certified audiologist Dr. Joni Davis is back to tell us that there is hope for a treatment. You don't have to live with that ringing, right?
You are 100% correct. I feel like I live my life telling people that there is hope. And, you know, that's actually really huge. And that is the big message I want everybody to take from today, because the general medical community is not aware that there is treatment for tinnitus or tinnitus, whichever one you want to call it. Both are acceptable. I've seen several ear, nose, and throat physicians and primary care physicians that have told people that they have to live with it because there's nothing that we can do about it. And that is absolutely untrue. There is so much that we can do about it. And there are a lot of different causes as well. Okay. So if you have impacted wax in your ear, you can get ringing in your ears. If you have allergies or sinus symptoms, you can get ringing in your ears. 90% of the time, if you have a little bit of nerve damage or a little bit of hearing loss, most people end up with ringing in their ears as a symptom of it. So the cool part is, if you go to treat your hearing loss, 75% of the time, just turning the hearing aid on completely eliminates the tinnitus that you're experiencing. And it's such a fun thing that I do in my office. I turn the hearing aids on and I watch people go, oh, it's gone. I've been listening to that for 20 years. This is amazing. And you don't realize just how stressful it is to hear this constant sound in your ear. And it doesn't have to be ringing. It can be chirping. I've heard crickets. I've heard bells whistling. I've even heard music. There's something called musical ear. People who have a severe hearing loss can hear the same song over and over and over again in their brain. Could you imagine listening to that all of the time? So when we're able to get rid of it, it's a really good day and everybody's very happy.
I don't even like when I get a song stuck in my head, let alone something like that.
I know. So, so I said 75% of the time hearing aids eliminate it. That 25%, almost all hearing aids you get now have something called a tinnitus masker in it. Okay. And what we're able to do is program a soft, gentle stimulus, like a real soft white noise, something that's not irritating, right around where their tinnitus is. We can measure it in the office, and that retrains the brain to block it out and not pay attention to it. It's very relaxing for people who are really aggravated by hearing that sound all of the time.
And I know you've spoke about your patients before in the past, and I am sure it really is a life-changing relief. And of course, they're getting the benefits of a hearing aid as well. Now, I know hearing aid is not the only thing you do, because you talked before, you also do cochlear implants?
Correct. And I've had people come in who are experiencing hearing loss, but they say, I don't care that I can't hear. Get rid of this noise in my ear. And the cool part about cochlear implants is it always gets rid of the ringing. And I had a patient the other day who has 2 cochlear implants, and he was severely bothered by tinnitus, and he makes a point to go out and tell everybody that he doesn't experience it at all anymore. And he just walks around with a big smile on his face all of the time, which is why we do what we do every single day, to make a big difference.
And as far as seeing patients, what do you, I mean, whether it's the ringing in their ears, whether it's the cochlear implants, I mean, you treat each patient differently and find out what the problem is, which is the importance of seeing an audiologist like yourself, right?
You are correct. I mean, if you go to the store to buy a phone, how many people are overwhelmed when they go in and look at all of the options for a cell phone, like, I don't know which one I want. It's kind of the same thing with hearing loss treatment. There are different types of hearing losses. Everybody has a different lifestyle, a different personality, different needs, and there is a solution for everybody, but how are you supposed to know what's going to work best for you if you don't go see somebody who helps walk you through the process? And that's what doctors of audiology do. We're here to find the solution that is perfect and individualized for each patient who walks through the door.
Well, if you think maybe you can benefit and want more information on how Davis Family Hearing can help, well, you can call or visit their website. All of the information right there on your screen. Please come back, because again, I can tell how passionate you are about educating people and just getting this message. So thank you for sharing it with our Morning Blend viewers.
My pleasure.